vision at the Royal Cornwall Hospitals Trust is to provide brilliant care to one and all. But how do we know when that vision has been achieved? The fact is, we all know that for most things there is always room for improvement, and therefore change is required to achieve it. So even if we think we are providing brilliant care, there are always adjustments that can be made to continually improve and achieve our ultimate goal of better patient outcomes and experiences. Whether that might be tackling the high priority complex issues demanding the attention of organisational leads, or just making tweaks to a process that results in improvements to a service or job role. As healthcare providers and clinicians, we would expect and encourage our patients to be proactive in improving their lives. So why wouldn't we, as a healthcare provider, have that same expectation of ourselves? At the Royal Cornwall Hospitals Trust, we do. And everyone has a role to play, from staff to patients and their families. So what is quality improvement, or QI as it is known in healthcare? It is the continuous process of looking at how we as individuals, as teams and as an organisation could do things better, safer and more effectively and efficiently to bring about brilliant improvements for the care of our patients. So, what is the QI Hub?
Well, the aim of the QI Hub is to build QI quality improvement capability in the Trust through support and training and the use of internationally approved QI methodology.
So what does it mean for me? So the QI Hub is a place where staff members can come and learn QI tools and techniques. They can discuss and gain support for their ideas from other people that are already undertaking projects, and we can give them the tools and the techniques to deliver the project for themselves.
So by giving everyone the ability to do QI, and by giving access to resources to support them, that will in turn support the care groups to deliver sustainable improvements, which in turn support the Trust in delivering large-scale organisational improvements, all of which are working towards improving patient outcomes and experience. So how do we use QI tools and techniques to make care better? How do we improve? Firstly, we need a foundation to follow, a roadmap if you like. That foundation is based on the answer to 3 questions. What are we trying to accomplish? How will we know that the change is an improvement? What changes can we make that will result in improvement? This is known as the Model for Improvement.
Hello, I'm Mark Jadaf. I'm an emergency department consultant at Royal Cornwall Hospital. In 2018, we decided to use quality improvement methodology, the Model for Improvement, to try and effect a change in how we were caring for patients with severe sepsis.
What are we trying to accomplish? This is setting aims, the ultimate goal that we're trying to achieve. What are we going to improve and by how much?
So those patients need treatment within as short a space of time as possible once sepsis declares itself. And when they arrive in the emergency department, we believe the clock starts ticking for us to identify or exclude sepsis on our patients, and therefore find a way of getting to them the treatment that they really require. And that could be fluids and antibiotics, and a senior doctor review.
How will we know that the change is an improvement? This is establishing measures, identifying and choosing elements that can be measured that will give a reliable indicator to tell us if we're making an improvement.
The main one that we're using is a process measure, so that's time to giving a patient fluids or antibiotics. We also really want to know whether or not the outcomes have changed. And that main outcome from sepsis is actually mortality. That can be very hard to measure, but the hospital has a standardised mortality ratio for sepsis, and so we were able to track that as the project went on. And you also need to think about balancing measures. When we put in place changes, there's things that we don't expect to happen which are likely to happen. And so for that we gathered qualitative feedback from our staff both our nurses and our doctors, to find out how the changes that we were putting in place really made a difference.
What changes could we make that will result in improvement? This is selecting the changes and identifying what is doable.
We first of all drew up a driver diagram to find out what we thought would actually make a change. So we thought perhaps having the fluids and the antibiotics near to the patient that was going to need the treatment would make a big difference. So we set up a trolley, a sepsis trolley, and made sure that that was regularly stocked by the nursing staff. We also decided to roll out an education programme to our staff, so our nursing staff and our doctors all went through some form of education so that they could recognise sepsis when it presented and also then hopefully treat it in a timely fashion.
Having answered these questions, the next steps are to plan the different approaches. Try them, see if they work, then adapt them until they do. This is known as the PDSA cycle. Plan, do, study, act.
Our process measures were improving. So we were able to go through PDSA cycles and change those process measures so that we were able to deliver fluids and antibiotics within a shorter space of time. And lastly, the balancing measures. So we heard back from our consultants that they were getting more interruptions due to the fact that people were flagging sepsis up at an earlier stage. And we heard back from our nursing staff that actually it was often very difficult for them to find the person who was going to deliver the treatment. And so we had to listen to those things and again build those into further PDSA cycles.
So, in summary, we plan the test, do the test, study the test result, and act based on those results. Repeat and fine-tune based on learning, then adapt and either adopt and spread the changes, or if necessary, discard them. QI is just simply making things better.